Okay, assalamu alaikum. Sorry for being late because we have a meeting here in the university, so that is why. Okay, your home task was venous and lymphatic drainage of the upper limb, right?
Yes, ma'am.
Yes, sir.
Okay, so let's start.
Yes, ma'am.
So Basit, will you start? First of all, switch on your video that I could see you. And
Yes, ma'am.
so Basit.
Yes, ma'am.
Okay. Okay. So let's start with the venous drainage of the upper limb. So how this venous system is working in the body.
Yes, ma'am. Ma'am, the veins of upper limb is divided into two sets,
Mm-hmm.
superficial and deep.
Mm-hmm.
Superficial are placed beneath the skin, and the deep veins accompanies the arteries and constitute the venae competence of those vessels.
Mm-hmm.
Uh, the dorsal digital veins drains into the dorsal metacarpal veins, which united to form a dorsal venous arch or network. They
Mm-hmm.
drains now all those things into cephalic vein and basilic vein.
Okay. So let's start with the basilic or with the cephalic vein. Okay.
Okay, ma'am. Ma'am, cephalic vein rises from lateral end of dorsal venous arch of hand. Descends on radial side of forearm anterior to elbow and continues up um the arm. Basilic vein rises from the medial side of the dorsal venous arch of hand, descends on the
Basit, we haven't finished with the cephalic vein. So you see, it starts from the dorsal venous network, right?
yes, ma'am,
From the
arch of
dorsal
hand.
venous
Yes,
arch. Okay, so then it lies in which side of the forearm? So how it goes? How it's lies?
radial side of forearm, anterior to the elbow.
Uh-huh. Okay. Then how it goes?
Then it continues up the arm in deltopectoral groove.
And then?
Cephalic vein rises from the medial side, rises from the medial on the arm of forearm of elbow in the middle of arm.
So
And
we are talking
then
about
we
the
have
cephalic
medial cubital.
basis. We haven't finished
Yes,
with
ma'am.
the cephalic vein. So you said that it goes, lies in the pectoral, clavicle pectoral groove. So, so what happens then?
Ma'am, it pyresis clavipectoral fascia
Mm-hmm.
to drain into the axillary.
to the axillary vein. Okay, so you see it arises in the arm, in the lateral border of the biceps, and then it will lie in the so then it will go to the delta pectoral triangle, and yes, it's that's in the pectoral fascia, and of course terminates in the axillary vein. Okay. Kashif?
Did you say my name?
Kashif. Kashif Ahmad. Kashif Ahmad, where are you? So Kashif Ahmad is not responding. Okay, Huraira? Huraira did. Huraira.
Yes, ma'am.
Okay, switch on your camera.
Okay, ma'am.
And let's continue with the basilic vein.
Yes, ma'am.
So let's continue with basilic vein. So where from its origin, and how it runs, and where to it drains, okay?
Ma'am, your voice is not clear. Write in the text, ma'am.
Okay.
Ma'am, basilic vein. What should I tell about basilic vein?
Everything, what you know.
Ma'am, basilic vein is a large superficial vein of upper limb that help drain parts of hand and forearm.
Go on.
Ma'am, what should next?
So tell us our region of the basilic vein, so how it runs, the route of the basilic vein, and of course about the where it drains to.
Ma'am, basilic vein, it originates from dorsal venous network of hand, ascends the medial aspect of the upper limb, and it is the border of teres major. The vein moves deep to the arm. Here it combines with the branchial veins from the venous system to form the axillary vein.
So you see, it's originated from the dorsal venous arch, right? And then it arises in the medial aspect of the forearm. Then it reaches the cubital fossa and then continues, so ascends in the arm. So it lies at the medial border of the biceps, and then at the middle of the arm, it will burst the deep pressure, and yes, it will join the brachial artery, right, and form the axillary vein. Okay, so what about the median cubital vein? So what can you tell us about the median cubital vein?
Medians of what, ma'am?
Median cubital vein.
Medians of
Cubital vein.
cubital, ma'am.
Yes.
Ma'am, the median cubital vein is the superficial vein overlying the biseptal aponeurosis in the roof of cubital fossa. It verbally forms either H or M type pattern joining the medial antebrachial, basilic and cephalic vein. Yes, ma'am. Ma'am, the median cubital vein is used for, it is a superficial vein of the upper limb. It is very clinically relevant as it is routinely used for taking blood and as a site for an intravenous cannula. Yes, ma'am.
Okay. What about the median vein of the forearm?
Medial vein of forearm, ma'am.
Yes.
Ma'am, medial vein of the forearm, ma'am. It is, ma'am, the vein in the medial vein in the forearm is a superficial vein of anterior forearm that drains the superficial structures of forearm and wrist between basilic and cephalic vein.
So where it's originated?
Ma'am, which vein?
This vein, where from it originates?
Ma'am, forearm vein.
Yes, anterior forearm. Anterior median vein of forearm, yes.
Ma'am, the interior median vein of forearm is located at the around the radial side of the wrist. The vein, it is the vein that ascends long side of radial artery on the medial edge of muscles until it reaches the cubital fossa.
So where from it originates?
Ma'am, it it originate the medial forearm originates from the ma'am, it travels up it travels from the ulnar side of the front forearms and end in the basilic vein in the vena media cubital.
Originates where from? The same question.
Ma'am, I am telling about origination of forearm, vein of forearm.
So where from it originates?
And from where it originates?
Yes, from which place it originates?
Which place, ma'am? Ma'am, this vein originates from the ulnar. Ma'am, this vein originates from the basilic vein on the middle aspect of the forearm at the wrist from the dorsal venous.
No. So you see, we have a superficial and deep palmar arterial arches in the palm, right? And all these arteries, so they are accompanied by the vena commitans. So they constitute the superficial and deep palmar venous arches. So you see, from the palmar venous arches, arises the median vein of the forearm. So is it clear? Is it clear?
Yes, ma'am.
Yes, ma'am.
Okay, let's summarize. So we said that venous system is presented by two types of two types, right? Superficial and deep. So when we are talking about the superficial, we think about these veins, basilic and cephalic, right? So both these veins originates from the dorsal venous arch, or we can say that dorsal venous network, which is present on the dorsum of the hand, and from the medial side originates the basilic vein, and from the lateral side, so it runs the cephalic vein. So you see, the cephalic vein drains into axillary vein. And if we talk about the basilic vein, you understand that it will, in the arm, in the middle of arm, it will join with the brachial vein, and they form axillary vein. So at the level of the, we said the delta pectoral triangle. So at this region, the cephalic vein drains into the axillary vein, and then so they both form the subclavian vein. So from the lateral border of the first rib starts the subclavian vein, right? So is it clear?
Yes, ma'am.
So you see, the venous
Yeah.
system is very simple. You have to just remember from which side goes the cephalic and the basilic veins. So this is what about the superficial veins. So what about the deep veins of the upper limb? So Najam, will you tell us about the deep veins?
Yeah, ma'am.
Upper limb? Najam.
Yes, ma'am. Hello, ma'am. Are you hearing me?
Najam, will you tell us about the deep veins? Switch on your video, first of all.
Yes, ma'am.
Najam,
Yes, ma'am.
switch on your video. Yes. Now let's continue.
Basically, there are two types of the veins. Number one is the superficial vein, and number two, the deep veins. The veins which are present in the subcutaneous layer, these veins are considered to be the superficial veins, and the veins which are into the deep of the body, that is known as the deep veins. And it contrasts with the superficial veins and deep veins almost beside the artery, and same name. For example, there is the femoral vein, the beside the femoral artery.
Femoral artery. We are talking about the upper limb.
No, ma'am, I just gave an example.
So give example of the upper limb, okay? So for example, we have a ulnar artery. So
Ulnar artery.
we
There will
have
be
a
the ulnar
ulnar
vein.
vein.
Ulnar vein, yes. Same name, ma'am. But some present in the artery and hair present in the vein, ma'am.
So you see, the veins, the deep veins, they accompany the arteries, right?
Yes, ma'am.
And they have the same names, and you have to know that the deep veins they are presented by the by the vena comitans, right? Comprise the vena comitans, and they usually are paired. And of course, they
Yes.
accompany the large arteries. So ulnar vein, so you see we have a radial ulnar veins, and they join and form the brachial vein, right? And you see the brachial vein joins with the cephalic vein, with the basilic vein, sorry, and they form axillary vein. Okay. So, so you see, we have a axillary vein, and as we mentioned that axillary vein at the lateral border of the first rib, it continues as subclavian vein. So then subclavian vein extends from the first ribs to the sternal end of the clavicle. It will joins with the internal jugular vein, and they form brachiocephalic vein. So this is what concerns the veins. So let's talk about the lymphatic drainage. And you have to know that the superficial veins are used for the venipuncture and so for venous transfusion, and most of all, and so commonly used the median cubital or basilic veins. So they are veins of choice for catheterization, for transfusion. So let's talk about the lymphatic drainage, okay? Lymphatic drainage of the upper limb. So Rahim, we'll start with the lymphatic drainage.
Yes, ma'am. Ma'am, there are almost 20 to 30 lymph nodes in the axillary region, known as the axillary lymph nodes. They are present. They are present just inferior to the skin and anterior to the clavicle. Okay, and they function to drain the vessels of the upper limb, all the vessels of the upper limb, and the chest wall. Also the lateral quadrant of the breast. And they are known as they have two groups: the anterior group, also known as the pectoral group, and the posterior group, also known as the subclavian group.
So Rahim,
Yes, ma'am.
sorry for interrupting you, but let's start from the vessels, okay? You see, yes, lymphatic vessels. So then you see the lymph is gathered from the upper limb into the lymphatic vessels, right?
Yes, ma'am.
And then it will drain into the nodes. So first of all, what types of vessels, lymphatic vessels, do we have?
Ma'am, we have the lymphatic capillaries, which are the smallest vessel, and they drain from the interstitial spaces. Then those lymphatic capillaries go into the lymphatic vessels, and the lymphatic vessels contain these lymph nodes, which are swellings in the lymphatic vessels. And then these lymphatic vessels, they drain into major lymphatic trunks.
So you see, in this upper limb, so we are talking about the upper limb. So we have two types of lymphatics.
Yes, ma'am.
You see, these lymphatic vessels also always accompany the veins. right?
Yes, ma'am.
So
Yes,
you
ma'am.
see, we have a superficial and deep
And deep,
veins,
drainage,
right?
yeah.
Yes,
So
ma'am.
that is why we have a lymphatics. So they are also divided into two types: superficial and
Yes, ma'am.
deep.
Oh,
So is it clear?
yes, ma'am.
Yes, ma'am.
Okay. So what can you tell us about the superficial lymphatics?
Am I only that the general lymphatic vessels?
So you see, as we compare superficial and deep lymphatics, you understand that deep lymphatics, they are less numerous in number, and superficial, they are much more numerous in number. And superficial lymphatics, so they collect the lymph from the skin and subcutaneous tissues, right?
Yes, ma'am.
And they drain into axillary nodes. But we have some exceptions. So, for example, the lymph from the medial side of the forearm, from the hand and forearm of the medial side. So it drains into the superficial cubital lymph nodes, or it's called supratrochlear lymph nodes, which are present above the medial condyle, epicondyle of the humerus. So here we have this superficial cubital lymph nodes. So from these lymph nodes, then the lymph will drain into the axillary lymph nodes. So if we have a look at the lateral side of the superficial lymph nodes or lymph vessels, you will see that the lymph from the lateral side of the hand, forearm, and arm, it will drain into infraclavicular lymph nodes. So infraclavicular nodes, they are not strictly called axillary nodes because they located not in the axilla. So we call it infraclavicular lymph nodes. So there. But the deep lymphatics, as we said, they are less in number, but they collect lymph from the deep structures of the upper limb. So the structures from which lies deep to the deep fascia, and they drain into axillary lymph nodes.
Yes, ma'am.
So is it clear? Okay. So you see all
Yes,
the
ma'am.
vessels of the upper limb, then they drain into the lymph nodes. But you see, not all of them drain into the axillary lymph nodes. Some of them will drain into the infraclavicular lymph nodes. So, but from the deep structures, all lymph drains into the lateral axilla lymph nodes. So you see, in axilla, we have 5 types of the lymph nodes. So Rahim,
Yes, ma'am. May I
will you
tell them?
continue? Yes.
Yes, ma'am. Ma'am, we have 5 types of lymph nodes. The first one is the pectoral, also known as the anterior. The second one is the subscapular, also known as the posterior. Then we have the humeral, also known as the lateral, and then the central and apical. In the pectoral or anterior lymph node, we have 3 to 5 nodes that drain the lymph from the anterior thoracic wall, including the breast. And in the subscapular or posterior lymph node, there are about 6 to 7 nodes. They also receive they receive blood from the posterior thoracic wall and the scapular region. In the humeral or lateral lymph nodes, there are 4 to 6 lymph nodes, and they receive the lymph drainage of the upper limb. And in the central, they have 3 to 4 larger lymph nodes. These lymph nodes are larger inside, and they are located at the base of the axilla. So they receive the lymph from the efferent vessels from the pectoral and subscapular and humeral axillary lymph node groups. So all these pectoral, subclavicular, and humeral groups, they then drain into the central lymph nodes. And then finally, we have the apical lymph nodes, which is present at the apex or tip of the axilla, and it is close to the axillary vein and the first part of the axillary artery. All right, and they receive lymph from the efferent vessels of the central axillary lymph nodes. Yes, ma'am.
Okay, what happens then? Where
Ma'am,
to the lymph goes?
ma'am, after that, the
Yes,
apical.
from the apical group, yes.
I don't know what happens after that. I only did these.
Okay, so from the apical group,
They go into the subclavian lymphatic trunk. That's all I know.
yes. So they will drain into subclavian trunk.
Yes, ma'am.
And after subclavian trunk, it will drain into the, so from the right side, it drains into the right lymphatic trunk, and from the left side, it
Yes.
will go to the thoracic duct. Okay, and then they all drain into the venous system in the venous angle, right?
Yes, ma'am.
So this is the venous drainage of the upper limb. So okay. So your home task will be for the next class.
Ma'am, can you give us presentations again?
Presentation?
Yes, ma'am.
Ma'am,
I didn't understand. I have to give you a presentation?
No, assign us presentations.
Oh, a sinus presentation. You want to perform the presentations? Okay.
Yes, ma'am.
ma'am,
Yes, Najam?
ma'am. Previously lecture I have missed, ma'am, but I have done my work, ma'am.
Okay. So what? You had to make a presentation about the diseases, right?
No, ma'am. About the arteries, ma'am.
Yes,
Previously,
about the diseases of the artery.
yes,
So
ma'am.
Raynaud disease. Okay. Now you can make a presentation, but first of all, write your home task. Okay.
Yes, ma'am. In the next lecture, ma'am, I will
For the
display.
next class.
Yes, ma'am.
What? What, Najam?
Ma'am, I am saying that in the next class I will perform the both topics that were given by you, ma'am.
Right now, you will present, share with us with your presentation, with your slides, okay?
Yes, ma'am.
But before it, let's write the home task. So I will write you here, home task. Home task is about
यार उसामा अपना माइक ऑफ करो.
thoracic. Okay, thoracic and abdominal aorta. And I think we will take a venous drainage also of the thorax and the abdomen. So it will be a big topic for you
Ma'am,
for the
please
next class.
repeat.
Ma'am, thoracic and
So I will write you venous
thoracic
and lymphatic drainage. Lymphatic drainage of the thorax thorax and abdomen. So you see, it's I think it's very big home task for you, but we have no time. You see, there are 3 lessons left, and we have to review. So we have to pass the thorax, abdomen, the lower limb and the pelvis, and of course neck and head.
Yes, ma'am.
So that is why your home task will be, I can say, huge.
Excuse me, ma'am.
No problem, ma'am.
Really, no problem.
No problem, ma'am.
No
Yes,
problem, ma'am.
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 Okay. So please prepare these topics. I think that thorax was given in the lecture, right?
Yes, ma'am.
So maybe then, I don't know. So I have to ask your lecturer. So what he will prepare for the next 2 lectures. I think it will be abdomen also.
Yes, ma'am.
So I
Okay,
hope
ma'am.
that, yes,
Ma'am, we have to prepare these topics for the next class.
yes, for the next class.
Okay, ma'am.
So you see, it's a very big topic, large topic, because abdominal aorta, we have there a lot of
Yes.
arteries. So we have there select trunk. So from the select trunk, we have a lot of branches, and from the abdominal aorta, so we have a lot of branches there too. So please be attentive, and so you have to remember all this.
Yes, ma'am. Thank you.
Okay, ma'am. Yes, ma'am.
Okay. You're welcome. Okay, so Najam, I will make you host. Okay, so
He is not prepared yet.
how he's not prepared? He said that his presentation
Ma'am,
is
he
ready.
said that he will give presentation in next lecture.
In next
Next-
lecture,
Yes, ma'am.
In next class, we
He
will
said
not
that.
have time for his presentation, but
Yes,
Oh,
ma'am, give him 20 minutes.
Najam,
yes, ma'am.
you text
Ma'am,
me.
my slides are ready, but ma'am, thing is that there are a lot of slides. They are here and there, ma'am.
ड्रामे कर रहे हैं,
It's
ma'am.
okay, we will manage. Start, Najam, it's okay.
So you
Okay.
see, Najam, you
Okay.
wrote me yesterday at 3
Yes,
p.m.
but
You wrote me.
but
that You
I'm
wrote
so
me.
sorry.
I had done my task that were
Ma'am,
given
actually,
by
ma'am,
you.
ma'am, actually, he is so shy. Ma'am, he is shy.
Basit, stop it, okay?
Ma'am,
I'm talking to Najam.
Okay,
ma'am,
ma'am, sorry.
I'm so sad you didn't reply to me, ma'am. That's why,
Of
ma'am.
course, I didn't reply because I was too busy. I had classes yesterday, whole day. I haven't time for replying for your messages.
Yes, ma'am. Okay, ma'am. I have slides, ma'am. I can search by screen sharing, ma'am.
So what does it mean? Will you share your slides right now or not?
Yes, ma'am. Just 2 minutes, ma'am. I'm searching slides.
Okay, we are waiting for you. You know, I made a mistake on the previous class. I gave you only venous and lymphatic drainage of the upper limb, but I had to give you at least thoracic aorta also to divide this topic on 2 or 3 parts. But I forgot about it, and that is why for the next class you have to prepare this.
It's okay, ma'am. We have a week. We can do it.
Yes, you have a week.
और ये बच्चा प्रेजेंटेशन ला रहा है। मम्मा मेरी भाई बैठी है।
यार नजम मैम को बता हम भी हाजिर यार, हमारे भी हाजिरी लगाओ, ऊपर से ना लगाओ।
Can you translate what he was telling?
Ma'am,
Ma'am.
mark him. Ma'am, he is present. He is saying that mark, don't mark me absent.
Ma'am, in the home task, do we have to do breast supply and drainage as well as thoracic? Are breasts
Breast.
included in thoracic?
You see, the topic is too much, so we will not take the breast. So you can tell that this is supplied by this arteries, okay? On the breast.
तबीयत ठीक हुई है? पेन ढूंढ रहा था। मुझे लगता है ये नहीं चलता।
Him, अपना mic off कर दो।
We have to do the cardiovascular system and other than that,
And nervous system.
and nervous system.
Yes, the second model will be a nervous system.
Okay.
Okay.
Najam,
Yes, ma'am.
so you are making your slides from the beginning?
No, ma'am.
But you asked for a couple of minutes, but you know how many time has gone?
Okay, ma'am. Okay, ma'am. I have just. I'm sharing now, ma'am.
Okay. So I don't need that you have to prepare 30, 40 slides. You have to prepare just 5 to 10 slides. And,
No, ma'am. Actually, ma'am,
make a
actually,
short
ma'am,
presentation.
ma'am, actually, I have a lot of slides. That's why, ma'am.
So we don't need so many slides. You have to just explain us what is it. So the definition.
Actually, ma'am, my slides are.
Which complaints will have. So how it will look like.
Actually, ma'am,
We
my
do
slides
not
are.
need
Yes,
the.
ma'am. You can see at this, ma'am. I have a lot of slides, ma'am, and they are intermixed. That's why I'm searching, ma'am.
Your
Okay,
slides should be accompanied, not accompanied, so they have to be in one file. Yeah.
yes, ma'am.
Okay.
Because ma'am, I have lot of subjects file. That's why ma'am, it is intermixed. Ma'am. This ma'am.
Okay.
Yes.
All right. Home task.
Okay. Before discussing the arterial disorders, we just know what is the blood vessel. Blood vessel is such a connection which which takes the blood from one place to another place. For example, heart pumps the blood and heart wants to supply the blood towards a particular tissue by mean of some kind of channel. This channel is known as the blood vessels. And blood vessels are of the three types, and these are the veins, arteries, and capillaries. As we know that the capillaries are very small and thin fibers, and they can travel blood towards the tissue. But after that, there are the lot of other lot of blood vessels that are known as the veins, blood veins, and the other one is the arteries. Today we are going to discuss about the arteries, and according to the structure of artery, there are the three layers of the artery: tunica adventia, and tunica media, and tunica intima. The tunica intima is also known as the endo part of the artery. It is a part which is present inside the artery, or it is a layer which is present inside the artery. After that, there is another layer which is known as the tunica media. After that, last one layer is known as the tunica adventitia. So our objective is to describe the arterial disease, that what kind of diseases are present in the arteries. Objects: to understand the nature of accumulation of artery disease and its accumulation symptoms and signs, and to able to assess the acute and chronic arterial infections and known as the treatment options, to know about the change and its management, and to know other the arterial diseases like the aneurysms, arteries, and vasoplastic disease and AV fibula. So first of all, we will discuss on the accumulation arteries disease. There are two types of the disease which are found in the arteries, that is known as the acute arterial accumulation and chronic arterial accumulation. And there is an embolism. Embolism can be brain, MCA, or retina ambulation forks, and matrix vessels, spleen, kidney, lungs, pulmonary embolism. And these are types of the embolism which are found in our body. So just we are discussing about the arterial stenosis. First of all, investigation journal, we can investigate any kind of the person who are suffering from the arterial disease. Investigation is simple. We can just describe the two types of the tests, which are the CBC and ECR. By mean of these tests, we can find out the plasma level of the plasma level of the patient, or the fibrogen and protein and electrophoresis and glucose and blood in the urine. By mean of these tests, we can find out these kind of things. After that, lipid profile. Lipid profile is such a thing in which we can see that how much concentration of the lipids are present in the body of a human being. As we know that the lipid is a major role, play a major role in the blockage of the veins. If we take a large amount of the fat, it will it will close our veins, and it will injure for us, and it also begins the heart stroke or heart failure. And after that, we can Doppler's usage of blood flow detection. We can see that is blood flow is passing clearly or not. After that, duplex imaging and echocardiography, or arteriography, or DSA, or ECG. And you can see that this is the technique which is simply known as the Doppler, handheld Doppler. And this the doctor checks the person's pressure, is the blood pressure is coming properly or not. And this is the color duplex, and you can see that this is the DSA, and this is the angioscope. After that, treatment is the embolic arterial accumulation is in the emergency. And we are just going to describe the thrombolysis. Thrombolysis can be defined as it is immediate extravenous heparin, and this is the unit. U is the unit of use simply unit, that is the prevent the distant and the proximal extension of thrombus, and its samples are certain are the distant strokes are active peptic ulcer. And ulcer is just we can say that uh, it is some kind of infection in the stomach, and we are saying here the peptic ulcer. The ulcer which is caused by the pepsin enzyme, that is known as the peptic ulcer, which is present inside the stomach. And the bleeding disorders, the person have the bleeding disorder, it means the person uh, lost a lot of the blood. Hydration and embolectomy and chromatectomy. And after that, there is another, the forgatory castration for the removing of proximal and distal uh, extension of thrombus. If person veins are blockage and they have the thrombus, means the blockage, and we can use a technique that is known as the forgatory castration for the removing of proximal and distal extension of thrombus, and post properly heparin and the anticoagulation. And after that, there is an intracellular thrombolysis. Only if ischemia is not to survive and immediate operation is moderated, it is possible to treat the thrombus and ambulances by the intra-arterial thrombosis. Agents TPA tissue are plasmogenesis activists, and trypanosinase and urokinase, these are the enzymes. If we can see that in the last there is a ASE, that is known as the enzyme, and these are two enzymes which are vital play in the thrombosis. Identify the treat and specific cause. I have some slides which are about the thrombolectomy. This one is a SFA, and other one is known as a removed thrombus. You can see this picture. This is the thrombosis. And after that, we are discussing the chronic arterial inflammation. Before discussing, we should know that what is the etiology of it. And etiology are the Buerger's disease and the arteriosclerosis, or arthritis sclerosis, and diabetes. These are the etiology of the chronic artery disease. And risk factors, which are the risk factors of the chronic artery inflammation. These are the hypertension, diabetes, family stroke, or strong family history, or smoking, or lipid abnormality. And the chronic limb ischemia. The ischemia of a lower limb may be the minimal to create, and also called chronic arterial inflammation, or a peripheral vascular disease, PVD, peripheral vascular disease. Clinical presentation. What are the clinical presentation of chronic limb ischemia? And these are the intermediate claudications, are comments just like the fatigue, etching, or cramping pain, occurring the extraction and relief by the wrist, and productively at the same distance. Cardiac distance, here we use this term that is known as the cardiac distance. It can be defined a distance at which the pain appears rest pain. If a person during the rest have the pain with the same distance as we discussed above, this is known as the cardiac distance. And critical ischemia can be defined as the several ischemia with the actual and potential tissue loss. The tissue loss ischemia, which is known as the critical ischemia. And what are the signs and symptoms of the ischemia or chronic ischemia? The loss of muscle mass or blood, and loss of subcutaneous fat from the skin. There is a fat which is known as the subcutaneous fat. To describe this term, sub means below, and cutaneous means the skin. Below the skin there is a fat which is known as the subcutaneous fat, and in this disease there is the loss of the subcutaneous fat. And after that, skin became the shiny, and loss of hairs, brittleness, and the grayness of ulcers of the foot. You can see this is the picture. In this picture, the skin is also shiny, and there is no hairs on the foot. It's
So you can
shiny.
see on the third finger, we have here gangrene. Yes. So you see this condition, which is, so it's a chronic ischemia, and it's caused, the risk factor, one of the risk factor is the smoking. So in persons who smokes, they commonly will suffer with this disease, because also they will have atherosclerosis in the vessels of the lower limb. But Najam, we are right now we are passing the upper limb, right? So you have to
No, ma'am.
find
You
the
about the disease of this, ma'am.
disease of the upper limb. So
Ma'am, I understand just a disease of veins. That's why I prepared all of the body, ma'am.
we have to you have to prepare the disease of the upper limb. Okay, what else? Have you prepared the Raynaud disease, for example? So what is it? Why it's present in patients?
What, ma'am?
Raynaud disease.
Raynaud disease, ma'am.
Raynaud disease.
Ma'am, please try the spelling, ma'am. I'm not getting properly.
Okay.
Raynaud disease.
Yes, Raynaud disease.
It is a rare disease of the blood vessels.
Yes, it's because of the innervation of the vessels, blood vessels.
Yes, more commonly in the fingers and the toes.
Yes.
By the narrowing of the vessels when you are feeling cold and shivering.
Yes, right. Okay, so I waited from Najam that he prepared about the Raynaud disease and some other disease of the arteries of the upper limb. Okay.
Yeah, ma'am.
Yes.
Ma'am, I can share my slide with my friends, ma'am, because, ma'am, there are interaction between slides, ma'am.
Okay.
Okay.
With whom you are sharing? So Najam, have you finished? Yes.
Yes, ma'am, I finished for now.
Okay, I will mark that you prepared the presentation. Okay. Okay, so you know your home task. Let's finish our class for today.
Yes,
so
ma'am.
please prepare the topics, the thorax and abdomen. Okay.
Yes.
And next class we will discuss all this. Okay.
Okay, ma'am.
Okay. So goodbye. Thank you for coming, and Juma Mubarak.
Ma'am,
Yes.
would you like to share the attendance of our US, ma'am? Because a lot of students are asking about the attendance, ma'am.
I didn't get. What did you say?
Ma'am,
You
I
want to
said
share
that
with your
please share
slides?
the. No, ma'am. I'm talking about the attendance, ma'am. Because my group mates are asking about the attendance, ma'am.
About attendance?
Yes, ma'am.
Yes, ma'am.
Oh, okay. So I will send you, okay, Najam?
Yes, ma'am. I will remind you, and then you can send me.
Okay, okay, okay.
Thank you, ma'am.
Okay, goodbye.